As the pandemic wears on, many hospitals are facing unique challenges, especially those in rural communities where they're seeing a rise in severe cases of COVID-19 but lack the equipment to help patients that are mostly ill. Reporter Joey Chafkick shows what those hospital workers are dealing with and has more on the problem in our top story tonight at 6.
In the rural Nebraska town of Fairbury, doctors and nurses are in a relentless fight to keep COVID under control.
You know, I would say this round of COVID is probably 2 or 3 times as bad as the first rounds.
Jefferson Community Health and Life is a critical access hospital. That means they have fewer than 25 beds.
In terms of the pandemic, we have a lot less resources.
Most notably,
We do not have any ventilators in this facility.
so very sick patients have to be transferred to bigger hospitals in bigger cities.
We just don't have the same ability to do things as often as a larger hospital does.
But with less than 10% of adult ICU beds available statewide, patients who need transfers have the odds stacked against them.
Sometimes we're sitting on patients maybe 6 to 7 days.
Even earlier in the pandemic, it was easier to get patients where they needed to go.
The past month has been the worst it's ever been since I started working here.
Morgan fears the worst could still lie ahead.
It's just a matter of time before we get in a situation where we've got somebody hooked up to a bag, we're doing this, and maybe having to do that for hours. Gosh, I hope not days.
For several weeks, Jefferson Community has had an average of 3 inpatients with COVID. That could pose a problem because the hospital only has 5 negative pressure rooms where patients with infectious diseases like COVID can be isolated.
Every time we've had to transfer a patient to an ICU bed or a higher level of care, we're either having to wait for hours or we're having to hold on to them for days.
That struggle to find empty beds has doctors on edge.
Yeah, it's very stressful, and you just wonder how much longer you can put up with that kind of strain.
Not to mention the strain of combating misinformation in a county where only 50% of the population is fully vaccinated. 80 to 85% of people hospitalized with COVID at Jefferson Community are unvaccinated. Others are immunocompromised.
I can't think of an example off the top of my head of a fully vaccinated person that came in here so critical that we had to transfer.
As for the future,
The scariest thing would be that if once or twice a year we're having these big outbreaks of COVID throughout the state, where we're in the position we're in now where we can't transfer people.
with no cure for these struggles in sight, a call for Nebraskans to stay vigilant and get vaccinated.
So that we can feel comfortable here in rural America that if we get somebody who's really, really sick, who needs to have a critical care doctor and an ICU right away, we can get them there right away.